Hello there, na Dr. Brownhida Santo don't come again. So we'll continue that our presentation on leg edema. For part one video, I be talk about many conditions the way they fit use different mechanism them. So I go talk about some condition them for here, but I not go name all of them. So go back go watch part one if you want to know about the many other conditions the way if it cause edema. So what be edema and how edema dey first of all happen? Edema dey happen na when you get accumulation of fluid in the tissue. And the tissue, another name for the tissue na interstitium. So you fit get tissue any part of your body. If it be for your leg, if it be for your arm, if it be for other part and for your body. So now edema that when you get the accumulation of the fluid where it cause swelling. It is so before I start name the condition them, I want also talk say it is so edema, the swelling of the leg, if it happen for one leg or for both legs, or sometimes if it happen for even both legs then, but one be bigger than the other. It also if it happen acutely, it just come abruptly, or if you don't get them for long time or say chronically. So I go name all these condition them, and then I go tell you now which condition them for suspect them when one leg be involved and when both legs can be involved, or when it come acutely or when it don't be chronically. So more start. Number one, na liver failure. Say this so liver disease be very common, and when you don't get liver disease where it don't become chronic, so they lead to heart failure, you fit get leg edema. Why liver disease be common for community? Because a lot of people they drink a lot of alcohol. Also, you get hepatitis B and hepatitis C where people they get them, where some people they don't even know so they get them. And 10, 15, 20 years down the road, they develop liver failure, especially if you also drink. So what it be some of the signs and symptoms and way if you make and you suspect say this leg swelling there, so if it come from a liver, some people will get what they call them jaundice. Their eyes will just be yellow. And I will put pictures and for year more now see way when I name these conditions them or these signs and symptoms they wanna see what way it look like. Sometimes there's so some people they feel get some their abdomen go just big where now fluid on the accumulate inside the abdomen, which way they call and say ascites. Sometimes the way some people they go get like some you'll see like some redness almost like a spider web when a blood vessels them they call and say spider nerve. Sometimes some people them especially for man picking them you'll see one bobby or both bobby go just big, it go just start big. Something they call and say gynecomastia. Sometimes for some people them you go see a way around their navel, around their umbilicus, you go see dilated vessels them for day, which they call and say caput medusae. Some people them also they forget their way they call and say palmar erythema, where their hands them, you know, if you look their palms them, it just the red, sometimes it be painful even. So when you get these symptoms them or these signs them and you get leg swelling, you get for start suspect you know something. It dey like say my leg swelling they so now from my liver. Maybe I go hospital go check them. What it be another common disease, heart failure. How if you know say that leg swelling they so now from heart failure? If for instance you get shortness of breath, you know, it's sometimes that you want to try for lie down where before you be able to lay flat. Now you don't want lay flat, they say you know if you breathe, you didn't need for put your head up or for put pillows and put your head on top before you be able to breathe comfortably. Sometimes the way you go to feel like your heart they beat fast, palpitation. Sometimes the way you even feel lightheaded. And if you've been a person where maybe they don't tell you so you get heart attack, maybe they so you don't develop now a heart failure from that heart attack. If you've been a person where you get really high blood pressure where you no be control, where they tell you say hey control them or you need to control them, it is so if you get now heart failure. If you also been a person where you drink a lot of alcohol, in fact alcohol, especially when you did really drink a lot over time, if it cause you for get heart failure. For people that they use drugs, if you overuse drugs them, sometimes if it cause you for get heart failure. So if you be say you get any of these signs and symptoms, then where I don't just mention them, and your leg is swell, maybe in a heart failure. If that is the case, go for hospital. They go check you. They go even do ultrasound of your heart. Wait till they call and say echocardiogram, and it go give an indication of wait till your heart function and your heart capacity it looks like. Another condition na filariasis, where na a parasitic infection where it caused by a roundworm. This particular infection dey so it affect na the lymphatic system. Remember say we be talk say that lymphatic system be important for drain that remaining fluid from the tissue back into the vein and then to the heart. So if e be say you get this filariasis and you not treat them, that roundworms and they go stay for that lymphatic system, go attack lymph nodes them where it be part of that lymphatic system. Lymph nodes na some center where it get cells and for the way it help you for fight infection. When this parasite go be for day, if it born picking them, it replicate, then it even cause obstruction. Or sometimes because of continuous inflammation and you not treat the disease fine, if it even cause scarring, fibrosis, and then it go block that lymphatic system. When this happen now, you go get swelling of your leg. You go get develop what they call and say lymphedema or elephantiasis. Other conditions or diseases where they feel involve this lymphatic system na cancer. So for instance, if you get any type of cancer where it press on that lymphatic system or it obstruct that lymphatic system because it don't spread, it go for that lymph nodes them, and then it go cause obstruction. Anything will affect that lymphatic system, if you also cause swelling for that part for your body. Sometimes surgery where they do and too where involve that lymphatic system. For example, people that get breast cancer, sometimes they go remove the breast. They also remove the lymph nodes them for check on whether the cancer don't spread for day, or if they know say the cancer don't spread for day, when they remove it now, it will now disrupt the functioning of that lymphatic system. Then you go see and say that person, that arm, that extremity, it be swollen. So cancer too, if it cause you forget lymphedema, when that swelling of your extremity. Blood clot, another condition where if it cause you forget leg swelling. For instance, when you get blood clot, it go now for your vein. It go for that vein, it go obstruct the normal blood flow where you get forget that inside vein. As a result, blood go back up into the capillaries, and then more fluid go leak into the interstitium or the tissue, causing leg swelling. Wait way if you make them, wait be the signs and symptoms the way if you make them, you suspect say this so now blood clot they make my leg it be swollen. Generally, and I say generally because it's rare for you forget blood clot for two two legs in one time. Generally, it usually be in a leg swelling, one leg they swell. You go just get some, your leg will swell, it go be, sometimes it will be warm, it will be painful, if it be red, and you feel also suspect, say maybe in a blood clot, if you get certain conditions or certain predisposing factors. Example, if maybe you do some long journey, you travel, where you sit down for inside motor a lot, and then the next day, one wake up, you get a leg swelling when for one side and all these other symptoms that I don't mention them, suspect say maybe in a blood clot. People there they take birth control pills, people there they smoke, people there they get cancer. Now some condition and the way if you make and way be at higher risk for get that blood clot. In fact, even if you get family history too, some people there they for their families, maybe papa, mommy, or brothers and sisters, they don't get blood clot. If then too they want to wake up so they see their legs be swollen and other signs and symptoms, you get for suspect to say maybe you get blood clot, go hospital, make the check. Another condition is cellulitis. Cellulitis, it too they generally happen for one leg, but if it happen for both legs then two though, where you go see redness with your skin, pain, warm, sometimes they will even get fever. And in that case, if na cellulitis cause them, your doctor will give you antibiotics for treat the infection, because cellulitis is an infection of your skin. Another condition is chronic venous insufficiency or chronic venous stasis. With veins and so they get valves, and that valve is functional for push blood forward towards the heart. So if you get any condition where e affect that valve e function. If the valve no dey function well, wetin go happen na say that blood inside that vein go sluggish. If even back up into the capillaries and then leak into the tissue, causing you to get edema. Now, wetin be some of the things that if you make you suspect say maybe na chronic venous insufficiency or stasis dey cause my leg edema. E dey so sometimes e dey happen for both legs. Okay, then you fit even see how your skin color kind of dark a little bit. E no really be the regular skin color. Sometimes some people then they way if they even get this chronic venous stasis where e don stay and they get different stages. For some people them, as it is stay, the longer you get and the worse it is, you fit start develop some veins and where they would show for your skin where it be dilated, it be engorged. They call and say varicose veins. For some people them, they fit even get really bad venous stasis where it will even lead to ulcer. And people the way they get chronic venous insufficiency or stasis, they be at higher risk for get cellulitis, where it means say infection of the skin. Kidney failure also, if it cause you for get leg swelling. What will be some of the signs and symptoms the way they will make you suspect say maybe in a kidney failure. It is so kidney failure be a little bit tricky, but some of the things that I say, if you realize say all of a sudden when you urinate, their quantity for of urine it not be as it used to be like before. If you also start seeing and say your urine now they be foamy or bubbly, like bubbles and for day. Some people in there they'll just be so tired, fatigue. Some people in there they go get nausea, they go lose appetite. Some people in there when they will feel like they will taste get like metallic taste, you know, in their mouth. Sometimes they so some person will be like for chop meat. He go just when you see meat, he neck the just turn. Or if you try for chop meat, he just feel like say he go vomit. So if you get these signs and symptoms them and your leg be swollen, especially if you be so if you also get high blood pressure where you no control them, or diabetes where you no control them, then it means that sometimes your leg swelling are from kidney failure. So go see a doctor, make they do testing and treat you appropriately. Certain medications then also, if it cause your leg for swell. Example, now steroids, like prednisone, methylprednisolone, dexamethasone. Now example then for some steroids. I dey call these names then so that more na recognize if una dey for the medication on this medication then. Also certain blood pressure medication then like amlodipine, philodipine, fit also cause swelling. Sometimes them some group of medication the way they call and say NSAID, non-steroidal anti-inflammatory drugs. Example na ibuprofen. If it also cause you forget swelling. Sometimes hypothyroidism when a low thyroid hormone. Thyroid hormone are some particular hormone will be important for body for function well. That also fit cause you forget leg swelling. Some of the other signs and symptoms and way if you make you suspect say maybe again at the thyroid deficiency or low thyroid level. Now when maybe you also just gain weight where you know they even really chop much. Sometimes your heart rate will just be so slow, or you go just be so sluggish, so lazy. You know, you just feel like your body no dey well, you just want sleep you not really be that active. So some of those symptoms they feel make and where you suspect say maybe na your thyroid. But some of these symptoms that I don't mention and this so it also happen with this other condition that I don't mention. But when you go see a doctor, they go check you and you tell them say may they also check your thyroid levels to make sure say not your thyroid be the problem. Now I don't talk about many conditions and way we fit get them and some of the signs and symptoms and way if it happen with that leg swelling, if it make you suspect say maybe you get that particular condition. Now the other important thing we need for know now, depending on how rapidly you get this leg swelling and depending on whether it affect na one or na both legs, you fit get an idea of which way it cause them. If it be say you get acute swelling, say you want to wake up one day so from nowhere you see and say your leg don't be swollen and it be painful, it be red, you suspect say this so you fit get na a blood clot, or you fit also get na cellulitis. So if na the case that then go for hospital. And in fact, with that blood clot, some people then they so they will get that leg swelling and they will get shortness of breath too. When you get shortness of breath where your leg swell, especially in one leg where it be swollen, suspect say that blood clot there. So if you don't travel, go to your lungs, go cause what they call and say pulmonary embolism. So go for hospital quick because now condition that way if even kill person. If, however, it takes now some time for you to get this leg swelling, or if it don't happen over a long period of time, most likely now that other condition that I mentioned, heart failure, liver failure, kidney failure, chronic venous insufficiency, hypothyroidism, so elephantiasis. So all those ones that are more chronic, it take time before you get them, or you get them for a long time. Elephantiasis is so it also generally affect one leg, but if it affect both legs and two. These other condition that I don't mention and two, it generally affect now both legs them. I know say I don't talk say more na go hospital, may they do examination and see which way they cause your leg swelling so that they feel treat you appropriately. But what be some of the things that way if you do them for help yourself? It depends on which way it cause them. The treatment will depend on which way it cause them. For instance, if you get na liver failure or heart failure, they will advise you say make you take you control the amount of fluid way you drink and also low salt, because that go if you take a lot of salt and drink a lot of water it go just go make that leg swelling worse. Now, if you be say again like thyroid problem, they will give you thyroid hormone for help for increase your thyroid levels them and for eliminate some of those symptoms them. If na blood clot where you get them for your leg, they will give you blood thinner for help with that blood clot. If you get na cellulitis, when an infection of your skin, they will give you antibiotics for help you with them. If your leg swelling being from that lymphedema, the elephantiasis, some particular drainage exercises, manual drainage exercises, then they by people the way they know how to do them, where if you help for reduce them, and also if you use bandage for tie the area there and for keep them clean for prevent infection. Sometimes even in some cases them they even do surgery, but you go need to see a doctor and then find out if you get specialized center the way if you handle them. So for summarize, for part 1 presentation of this leg edema, we don't talk about the mechanism them and plenty condition the way if you cause edema. For this part 2, we don't talk about some few conditions them and we'll go into more details with other signs and symptoms the way if you make I get idea as to which way they cause them. Not that all edema be serious. Some few ones in their way, if now from medications, if they stop the medication, it will go away. But majority of the time, I go advise when I say, me when I go see doctor. I hope say when I won't be able to understand leg edema and some of the conditions the way if you cause them. When I share this video with our friends and family them, with our church members them, with our WhatsApp group and other social media groups them. If una be doctors or una listen to me, or nurses, una share and una patients them. Una also like, comment, and subscribe for help for grow this channel so that more people them they feel also get this knowledge way at the share and with una. Una always remember, say knowledge is power and health is wealth. Dr. Brownhilda Santo. Thank you.